This is a continuation of the overview that I just gave. Now, first of all, I want to cover what a dental implant is. Like I said before, that when teeth are extracted, you start losing bone right away. The body is, the bone is a living structure. And so like on anything, is when it's used, it will maintain its health, just like our muscles. If we exercise every day, our muscles are going to maintain its tone. If we stop exercising and we don't use them, they're going to get flabby and atrophy, which means goes away. Bone is the same exact way. Bone is maintained by either teeth that are in the mouth, okay, or if it's stimulated by a dental implant. The stimulation that happens with a dental implant is, first of all, when a tooth is extracted, the dental implant is placed into the jawbone like this, okay? It's pretty painless. People say that when I'm done, I call them up. They hardly have any pain at all. That's because there's no real, there's nerves that course through the bone, but there's no nerves in the bone. So there's no nerves that you can actually feel, some sensory nerves that are on that, okay? So it's pretty, we call it atraumatic. It's not traumatic, and so it's a much better experience than a lot of people think. Placing a dental implant is, we make sure we have to have a certain amount of torque on it and for it to be good. So it stabilizes in the jawbone, okay? And then it takes about 4 months for actually bone to grow into the threads of the implant. Implants are made out of titanium. Titanium is used in metal plates, in screws that you may have in case you break a bone. It's the same exact material, so it's very inert to the body. It doesn't have any reaction to it, and so dental implants are safe for huge majority of people. But anyway, so it sits inside the bone, okay, and it grows in there, and then we can do a number of things with it. We can then place a single implant, is where we'll then place what's called an abutment on there, and then that abutment will represent what a natural tooth is, and then that abutment then the crown itself goes over the top of it so that it replaces that missing tooth. If, for example, if a tooth is removed and it's not replaced right away, then sometimes we have to do what's called grafting. A grafting procedure is where we try to regenerate the bone that was gone, okay? And so how we do that is we usually use a cadaver bone. It's sterilized, it's good to use, and your body's bone actually substitutes where that bone is, but it takes time to do that before an implant can be placed. Those types of details are generated, and we really analyze it with a cone beam scan, which is a three-dimensional CT scan where we can actually see the thickness of the bone that it needs to be placed. We know where the position of the nerve is, where the sinus is, all the different areas that will follow this video, and that will be an area where it's important to see how implants are and the preciseness of a dental implant placement. Please stay tuned, and if there's any questions, you can call us on our 586-247-3500. Thank you.